Welcome to Adapt NCLEX. If you are taking the NCLEX very soon, these 85 questions cover every major topic you will see on exam day, from prioritization to pharmacology, maternal health to mental health, newborn to peds, infectious control and fundamentals. I'm going to give you the concept to answer questions. First question, the first 10 are prioritization and delegation. How do you answer question? Read the question from the back. Try as much as possible to take your time. Read the question from the back and find the buzzwords. I'm going to underline the buzzword. At every question, I'm going to show you the keywords you're supposed to focus on. Which client is most appropriate assignment for the nurse? Which nurse? A nurse from the labor and delivery unit is floated to the medical surgical unit. Underline labor and delivery floated to medical surgical unit. So those are our keywords we're going to focus on. I'm going to focus on those information, and I'm going to put the check mark here, and check mark. Those are the one we're going to focus on. A client with what? Chest pain awaiting cardiac catheterization. A client 2 days post cholecystectomy ready for discharge. A client with what? Type 2 diabetes who need assistance with ambulation and glucose monitoring. 4, a client in sickle cell crisis requiring frequent IV opioid administration and what? Closed monitoring. What is the best way to answer prioritization question? I want you to divide the question answer choice into 2. Find the key information. Chest pain. What am I going to do? Cardiac catheterization. Post cholecystectomy, I need discharge. Type 2 diabetes, I need to walk and get my glucose check. I'm in sickle cell crisis, I need opioid administration frequently. Those are the things you're going to focus on. Now, what is the concept to answer question regarding floatingness? You have to pay attention. They should not get anybody who's getting discharged. They should not get anybody who's having new information or is a new admission or specialized information for the unit. The unit is med-surg. Cardiac catheterization is a specific to the unit, right? And patient requiring IV fluid and a patient requiring IV opioid and close monitoring is specific to the unit. Therefore, the only person who's safe and stable for the RPN, who is safe and stable for the floatiness, is a patient who just needs glucose monitoring. This is the way you should approach each question. And therefore, the right answer is number 3. This is the patient we're going to give it to that patient. Number 2, this is a prioritization. A nurse is aware of 4 pediatric clients. There's 4 pediatric clients in the emergency room. Which client should the nurse assess first? Same thing. Divide the question into 2, and I will guide you. I'll guide you every question, what you need to focus on. Stop the video, answer it on your own so that you can keep track of your score. Divide the question into 2 and say, age is not a factor. So 4-year-old, 10-month-old, 6-month-old, ignore it. Go for the buzzword. The 4-year-old with the fever of the what? After flu vaccine. Is this what you expected? The 4-year-old fell down the stairs with what? Forehead laceration and a nasal discharge. Is this what you expected? A 10-month-old with what? Projectile vomiting, crying, scaphoid abdomen. And a 6-month-old with the painless, this is a buzzword, scrotal swelling that trans-illuminate and there's no distress. Expected finding. If you want prioritizing strategy, check my YouTube channel. There's a bunch of video on B-sharp. That means you got to worry about breathing, electrolyte, shock, sepsis, airway, and pain related to that patient. A has a fever, but it's not sepsis. It's an expected finding when I give you flu vaccine. Eliminated. The second one, I fell, I have laceration. If you fall, you're going to have laceration. But what? Nasal discharge, I don't expect this. If you have projectile vomiting, crying, and scaphoid abdomen, and you are 10-month-old, you have pylori stenosis, an expected finding. If you have painless scrotal swelling, that means it's not painful, it's just swelling. And they transeliminate, that means there's fluid in it. And that is hydrocele, expected finding. Therefore, what do you think is the right answer? Patient who had laceration and there is clear nasal discharge. This is what we call CSF leak. This patient may have basal skull fracture, and therefore we have to pick this guy. He's in trouble. That's our prioritization. And you're getting the strategy now. This is number 2. These are questions from my QBank, Adapt NCLEX, and I've taken 85 of them, generated to generate these 85 questions to go across all most important topics you should be aware of. It's just concept. I'm not saying these questions are going to show up, but this is the concept. So write down the concept. Same thing. Which assignment is most appropriate for a new graduate? The word is assignment. Underlying in the question. The charge nurse is making assignment for a staff of what? RN, LPN, and a new graduate. 3 nurses. Who are you going to give to the new graduate? A new graduate is treated like somebody who is a newbie, just came to the hospital. Even though you are a nurse, we're going to give you certain patients. Who do you think? Somebody, new chest pain, awaiting cardiac catheterization. Somebody with amyotrophic lateral sclerosis with dysarthria. Somebody with what? Pulmonary embolism who is being started on what? IV heparin protocol therapy. If you're in that situation, taking the NCLEX, which answers you want to pick, stop the video, put down your answer, and think about it. But this is what I can tell you. You should not give them any patient who is unstable. New chest pain and cardiac catheterization is a bad problem. They cannot have it. 24-hour appendectomy, and I'm eating clear liquid diet. It looks like I'm stable. ALS patient with dysarthria. This is airway problem. Write it down. Pulmonary embolism, heparin protocol is complicated. They cannot have it. Therefore, the patient they're going to see is assigned to the new graduate is number 2. So this is the right answer. Like I said, the first 9 and 10 questions are prioritization and delegation. And nurses are aware of 4 clients. And so what? Who should be seen first? Okay, a client with a client with AAA, aortic abdominal aneurysm, will report what? Sudden back pain. Should I worry about that patient? If I have 4 patients, is that my concern? I'm underlying the bars rate. I have osteoarthritis. What am I doing? Knee pain and walking. Read the question like that so that it makes sense. It's not abstract. I have COPD. And so what? I report dyspnea on exertion. Okay, should I worry about it? I have multiple sclerosis and have what? Chronic fatigue. Then you write your B sharp and you say, is there any breathing issue here? I see a COPD patient is having dyspnea. Should I expect that? I see what? Electrolyte issue. I don't see that. Sepsis, nobody have sepsis, but you go through that, right? And then you manage it. AAA, who has reported back pain. I think this patient is bleeding. That's what? Rupture. Osteoarthritis, I have pain. If this pain is not going to kill me, I'm not going to lose my life, I'm not going to worry about it. But when do they have pain? When they walk, expected finding. Multiple sclerosis, you have chronic fatigue. I expect that. Therefore, what do you think? This guy is in trouble, he's in shock, he's bleeding. Number 5, and then he's caring for 4 clients, GI client, they have GI problem. What is going on with them? A client with pancreatitis with elevated amylase, a client with colostomy with a small bowel obstruction with distension, a client who just had cholecystectomy with shoulder pain, a client with gastroesophageal reflux who report what? Heartburn after meal. Once again, the way to answer prioritization is to make it your own. And then you divide it into 2 and you say, what? What am I worried about? I'm going to pay attention to some key stuff. A client with pancreatitis, I put a mark there. He has what? Amylase elevated. I have colostomy and I have small bowel obstruction. Cholecystectomy and I have what? Shoulder pain. I have reflux and I have heartburn. Which of this is an expected finding? You can see that this is an expected finding. Eliminated. Colostomy, you have obstruction and distension is not expected. Cholecystectomy and you have shoulder pain is an expected finding. If you have reflux when you eat, you're going to have heartburn. Who are you going to pick? I know you get the right answer. This is our patient that need further care. This is a problem. Small bowel obstruction. It can risk perforation. And this is assessing for maternity client. This is maternity. I did a lot of video series you should watch. It will help you master maternity. I will link some to this video. But what is the problem? A pregnant client at 3 weeks, he has a headache. A postpartum client with the firm fundus at the umbilicus. Patient is in labor, there's early deceleration, and a 2 days postpartum with a light lochia rubor. Divide it into two. Find which one should worry. If you worry, then you pick it, but you got to be sharp. When you pick the answer, that means not an expected finding, but something that has breathing, electrolyte shock, sepsis, airway. That's how you do prioritization. What do you think? 3 weeks old, headache. What do you think? 3 weeks pregnant, headache is not good. First trimester headache is not good, right? And it's severe. Adjective qualifying it. Postpartum client with firm fundus at the what? Umbilicus, unexpected finding. Client is laboring, early deceleration is what? A problem, right? 2 weeks postpartum, 2 days postpartum with light lochia, unexpected finding. I have headache and I have early deceleration. You know early deceleration is head compression. Therefore, don't pick it. Pick the one that shows you know how to do prioritization, and that is number one. For renal client, which renal client should the nurse assess first? Same thing. Go for the buzzword and underline it, and then think about what is going on. Connect the keywords in the question. I call it buzzword to answer the question. A client with what? Nephrolithiasis, and so what? Frank pain. Okay. Client with glomerulonephritis, and so what? I have periorbital edema. Okay, check. A client with what? Enoxaparin, I have what? A client on enoxaparin, I have what? Flank pain and bruising. Okay. A client with nephrotic syndrome, I have what? Proteinuria. What do you think? Nephrolithiasis is what we call what? Kidney stone. Kidney stone is an expected finding. You're going to have frank pain. I'm not going to worry about it. Glomerulonephritis, your kidney is in trouble. That means it's going to retain fluid. You're going to have periorbital edema. If you take enoxaparin, which is anticoagulant, and you have frank pain and bruising, what do you think? You're bleeding. What kind of bleeding? Retroperitoneal bleeding. Well, are you going to see it in the periumbilical area and in the frank area? What do you call this? This is what we call gray Turner sign. This patient is in trouble. Nephrotic syndrome is the same thing. Kidney is injured. You're going to lose protein, and therefore I see a bunch of what? Protein in your urine. So which one is our right answer? Pick it, this one. This is the way I want you to approach all of them like that. If you approach them like that, you can see that prioritization is easy. Now, same thing, assignment, patience, relax. There's a buzzword there. Don't let it trap you. And this is assigning clients to an experienced LPN. Buzzword, experienced LPN. If you take it the NCLEX and you see this word, ignore it. Just because you're experienced does not mean your scope of practice changes. You're still an LPN. What you do, we call it MMR most. I'm giving you the concept. You should write it down. MMR most. That means what can you do? You monitor most medications. That means not all, but most. You can do what? You can administer them. You can reinforce teaching. You can do stomach care. You can do tube feed. Those are the classified and special tests. Use that information to answer questions regarding what? LPN assignment. Therefore, a client with COPD who need scheduled inhaler, what do you think? A client 2 hours post mastectomy requiring initial wound assessment. A client with what? Diabetes who needs routine insulin administration and blood glucose check. A client with new onset of what? Confusion, fever requiring IV antibiotic. Client on warfarin therapy who need education about dietary vitamin. A client with what? Stable hypertension who require reinforcement. I give you the keywords. MMR most, right? And then you go for those adjectives. You look if the patient does not need anything that require initial assessment and teaching, as the RPN would do. Therefore, based on that, I see COPD, they need some medication. Most medication, they can do that. I see a 2-hour post-surgery. The word initial is negative. I'm not picking you. Diabetes patient, just say insulin administration. I'm picking you. New onset, I need an assessment. You're not picking me. I have warfarin who need education about what? Dietary. There's education there. No, they can reinforce it, but not initial education. You see, that's the way you should be thinking about each question. Think like that. Client with what? Stable hypertension who require reinforcement of what? Medication adherence. What do you think? Which answer choice will you pick? I've given you the clue that you can use to answer the questions. You can see that who should be assigned to an experienced what? RPN. The first person we're going to pick is what? Stable patient getting inhaler. Initial, negative. Diabetes patient, just monitoring. A new, I'm ignoring it. Therapy, education, not reinforcement, I'm ignoring it. And somebody who has hypertension, I'm giving it to them. This is what RPN can do. ACF is the right answer. Endocrine question. You can have endocrine prioritization. A client on metformin, what is the problem? Dark urine, muscle pain. A client with what? Hypothyroidism has what? Confusion. A client with diabetes insipidus, excessive urine output. A client with what? Type 2 diabetes with the fasting glucose of 140. All these prioritization questions are created is to test your knowledge about content related and the concept. And NCLEX will take this information and put meat around it and create their own question and use different language, but it's the same thing. Therefore, if you see this divided into two, ask yourself, what do I expect? Metformin. I have dark urine, muscle pain. This is what we call lactic acidosis. Hypothyroidism and confusion. I have mesothelioma, coma. Write it down. Diabetes insipidus, you're going to have excessive urine output, dehydration. Type 2 diabetes, your fasting glucose is not going to be normal, 140. Therefore, what do you think? Who are you going to pick? You know this is unexpected. You know this is unexpected. Now you're left with what? Metformin, dark urine, and muscle pain. Lactic acidosis is expected, but it's bad problem. But when you have hypothyroidism and you're confused, mesothelioma coma, you have to be in an ICU. It's bad. It's a bad problem. So mesothelioma coma should be our prioritization. Now we're switching gears. We're going to infectious control. We finished the first 9 questions. We are on infectious control. These questions may be a little bit tricky, but stay with me. I got you. I'll give you the key concept, and I want you to write it down. You can stop the video, write the concept down. If you're tired, get something to drink and come back. But this is what we have. The 4 school-age children are in the school nurse office. Click the SB for clinical data. Who need to go home? Then I click it and I say, who has to go home? I see 4 kids with multiple medical issues. Number 1, I have intense itchy rash with blister shaped like a wristband. What is that? A fleshy, painless tack-on growth on the hand and the feet. C, as a slap cheek rash on the face. And D, intensely itchy pimple-like rash with burrow on both hands. This is infectious control. I did not give you the name of the organism. I describe it, what they cause. expect the NCLEX to do that. So you have to be able to find what is the problem with this. Intensely itchy rash, blister shape. Look at it around the wrist. This look like what? Dermatitis. This is like contact dermatitis. So is that infectious? Ask yourself. Fleshly, painless is not painful. It's a stuck on to your skin. If this is your hand, you have something stuck on. This is what, right? And a slap cheek rash on the face. This is a fifth disease. An intensely itchy pimple like rash with the burrow on your both hands. This is like scabies. So you have scabies, you have fifth disease, right? Parvovirus virus. And then you have what? And then what? Contact dermatitis. You know, A is not infectious. B is not infectious. Fifth disease is usually what? What do you think? The fifth disease is a B19. That is a droplet precaution. But when you have rash in your face, it becomes standard precaution. So this is standard. Scabies is a contact precaution. Therefore, we're going to put a contact precaution patient. You should go home. You have a problem. Last patient is D. So I want you to master this kind of way of answering questions, and you'll be able to do well with this kind of thing. Same thing. A nurse appeared to admit a client with what? Meningitis caused by what? Neisseria meningitis. Which action by the nurse is appropriate? Before you answer the question, let me guide you. We're learning test-taking strategy, how to approach the question. Whenever you read the question, read the answers, go back to the question and dissect it. A nurse don gown, gloves, face shield before entering the client's room. What isolation precaution is that? A nurse don surgical mask and apply hand sanitizer before entering the client's room. A nurse don respiratory mask, face shield before entering the client's room. A nurse don surgical mask, gown before entering the client's room. Then you go back, don't pick an answer, go back to the question, find what the question is asking, come out with your own answers. I have a patient with meningitis and he has caused by Neisseria meningitis. What would I do? I know this is droplet. Therefore, every answer choice I'm going to pick, it has to say droplet. If it doesn't say droplet, it's wrong. And what do you need for droplet? All you need is a surgical mask. Don't bring whatever you do in the hospital. Over selection of answers is what make you lose point on infectious control. I said surgical mask. I never say anything. And then you do your hand hygiene. Therefore, gown and gloves is not surgical mask and face shield. This is not contact. This is droplet. This is gone. I see surgical mask. I said, check. You wash the hand, use the hand sanitizer before you go to the room and the other. This is what? Standard precaution. But this is what is changing the answer. It's a droplet. I see a respiratory mask. This is for airborne. Totally wrong. I see a surgical mask. Okay. But why are you wearing gown? Wrong. I know a lot of people who pick number one or or pick A or D, but that's not the right answer. You're over selecting. All we need is a surgical mask and provide hand hygiene. This is also key. So pay attention. A nurse prepared to admit several clients from the emergency room with rash. Which room assignment is appropriate for each client? That means assignment. You put the patient either in a private room, semi-private room, or with somebody, or isolated alone. So who client A has what? Erythema infections. What do you think? Erythema multiforme is B. Erythema migrans is C. And erythema imaginata. I put this question so that I can show you some of the traps the NCLEX will have for you. Watch for these words that as erythema and erythema. This is a learning I'm teaching you. If you know, stop the video and say, but I want you to write this down. Okay, this down. Erythema infections is a fifth disease. Erythema multiforme is usually an allergic reaction. Erythema migrans is what? Lyme disease. And erythema marginatum is rheumatic fever, right? Then, so I've converted this erythema into words that I can see. Fifth disease, right? A fifth disease. What would I do? What would I do in this patient? What do you think? They have rash already. As soon as they have rash, they are no more infectious. Therefore, they can be in semi-private room. The erythema multiforme is allergic reaction, semi-private room. Semi-private room means they can share a room with somebody. Migraine is what? Lyme disease does not need a private room. Marginatum is rheumatic fever, does not need a private room. Therefore, all of them need semi-private room. I just want to show you that all these are standard precaution at this time. So know that. A nurse is assigning a client with what? Erythema infection. I'm using that information. We carry on to that. It's a fifth disease. That means you already have rash in the face caused by parvo-19, right? Parvovirus 19 in the emergency room. Assessment shows slap cheek. There is a slap cheek on both cheeks. Which infection control protocol the nurse should implement? I already given you the answer, but I will show you if you answer this question, this is the way you should answer it. I see erythema infection caused by parvo B19, and I have what? Slap face rash, right? There's a rash in my face. If this is the kid, and you look, this is their nose. There's a rash here, and there's a rash here. What do you think? Is he standard precaution, droplet precaution, airborne, or contact? Parvo B19 is a droplet precaution. As soon as there is evidence of rash, the kid is fine. It's no more infectious. If you're no more infectious, you become a standard patient. So that's the right answer. I want you to know that as much as possible. Now, this is application of all this infectious control information. These are some of the things NCLEX will trap you with. So pay attention. Let's get this one done. And I want you to see if you can answer. Stop it and pick an answer. After attending a workshop on infectious control, which care is effective by the new graduate? That means know what to do with each of them. HIV patient, what do you think? Patient has closed unencrusted lesion. What do you think? The client with rubella, what kind of precaution? A client with adenovirus, what kind of precaution? A client with what? Rubella, what kind of precaution? Patient has active TB and a draining wound. What do you think? Stop the video, answer it, and let me see. But HIV patient, what do you think? It's a standard precaution. Honey-crusted lesion is impetigo. What is that? Contact precaution. Rubella is what? Is an airborne precaution. Pay attention. That one is very tricky. It's different from rubella, right? Therefore, rubella has to be droplet. Adenovirus is both droplet and contact precaution. And the patient with TB and has a wound, TB is what? Airborne, and having a wound makes you contact. This is the way it goes. This slide gives you a bunch of information about infectious control. What is your score so far? 14 questions. How are you doing? If you made it that far, thank you very much. Thank you for watching. I hope you learned something. And if you've learned something and this is helping you, thank you very much. Or put down a comment and say, I got it. Hashtag, I'm going on to number 15. So let me know how you're doing. Let me know how the video is helping you. Let's get to it. Number 15. The new graduate nurse will don a respiratory mask, gown, gloves to enter which client? I'm showing you another strategy to answer. Read it from the back. A new graduate nurse just attended staff a workshop on infectious control protocol. To show a correct understanding of the teaching, the new graduate nurse will don a respiratory mask, a gown, and the gloves to enter which client room. Therefore, what do you think? I'm giving you a clue. This is the way you should approach it. Who need a respiratory mask, gown, gloves, before you can go to their room. Think about it. Respiratory mask, gown, and gloves. Is he a patient with the scabies? Is he a patient with what? Adenovirus? Is he a patient with disseminated open shingles? Is he a patient with tuberculosis? Stop the video, put down your answer, and let me know. Let me show you how to break it down. I take the PPE and I break it down. A respiratory mask go with what? A respiratory mask goes with what? Airborne. A gown and gloves go with what? Contact. Who need airborne precaution and contact precaution? Scabies need contact precaution. Does not need airborne. Adenovirus needs droplet and contact precaution. I don't need that. Shingles, but it's spread all over. You treat it like varicella. Therefore, they need airborne and contact. Active TB need just airborne. Therefore, you know that C is your right answer. But this is the way you should break down the answer choice and you'll be able to answer that. Now, which item below is a common mode of transmission for the infection? It's a selected apply. Don't pick everything. Pick those that you're confident. If you know only one, pick it, and then you move on. And then care for a client with what? Hep C infection. How do you classify Hep C? Is it what? How is it transmitted also? Is it through the blood, your urine, vaginal secretion, feces, or semen? What do you think? The way to answer the question is body fluid. But which body fluid? There's 3 key body fluid that you can transmit Hep C. Body fluid, right? This is through the blood. Vaginal secretion and semen. There's a minimal amount in your urine and your feces. So that's the concept. I want you to write it down. Write it down. Next time you see that question, you can figure it out. Which infectious control precaution the nurse should initiate? Infectious control. A nurse prepared to admit a client with what? From the emergency room with severe generalized urticaria. Underline that buzzword. Generalized urticaria. Put it in the box. Figure out what it is. Do that patient need standard, contact, droplet, airborne precaution? Then you ask yourself, I know all precaution, but urticaria is like a rash that itches. What would it be? It's allergic or some allergic rhinitis or something. You don't need airborne. You don't need droplet. You don't need contact. It's a standard precaution. Don't let the NCLEX take these kind of easy questions away. It's designed to test your knowledge about things. This one may be a little bit difficult, but I got you. I'll show you how to break it. When you see it on the NCLEX, step back, don't answer it, go for the buzzword and listen carefully and write down the key as I explain it. Which selection of personal protective equipment, me trying to confuse you with the words, but don't worry, I mean PPE, that's all. Forget about it. By the nurse indicate a need for further teaching. A need means she did not do the right thing. She picked too many PPE. Why? A new graduate nurse is taking routine vitals. There's a word, routine. Why did I put routine in front of it? That's the way you answer question. Go for the words. Don't just skip it. For a client with what? He's draining abdominal wound. The wound has infection. By what? C. diff. That means if this is the patient, he has a wound that has C. diff in it. And I'm going to check vitals. Routine vitals. I'm not doing too touching the wound. I'm not changing dressing of the wound. I'm just doing routine vitals. That means they're doing, I said they need further teaching. That means they're doing something wrong. It's a routine vitals with the wound that is drained, but I'm doing what? Vital check. Therefore, I don't need a face mask. I don't need a face shield either. I don't need a sterile gloves. Even if I need the gloves, it's going to be regular gloves, not sterile one. That's the one. Isolation gown. The wound is draining, so I need to make sure it does not penetrate the gown. So isolation gown is wrong. Fluid resistant isolation gown means it does not go through the gown. That is much better. I don't need goggles. There's no splashing in my face. I'm checking vitals. Surgical mask, it's not droplet. N95, it's not airborne. You see how you can select too much? All she needs is a gown and the gloves. But this glove is sterile. We're not picking it. So this is the way you should answer that question. Was it hard? No, I got you. I think you can do it when you see this question again. Number 90. How are you doing so far? This is number 90 for our 85 questions on English practice question. This is the topic that shows up multiple times on NCLEX. We finished prioritization and delegation. Now we are on infectious control. A night shift nurse received a client with what? Shingles that is spread, disseminated from the emergency room. We see it already. This is application of that question. What priority information the nurse should provide to the client during orientation to the assigned room? That means patient has what? Disseminated shingles, right? What are we going to do when we putting them in their room? Do we wear, are we going to provide wearing of N95 masks in the room? Are we going to provide proper usage of call bell and location? Are we going to put a bedside commode? Are we going to what? Provide hand hygiene with soap and water? Which one will you prioritize? Then you go back to the question and you ask yourself, I have airborne, droplet, or precaution, or contact precaution. What do you think? Disseminated is spread over everywhere, shingles. That means I have airborne and contact. But I said, what would you do? Priority information the nurse should provide to the patient. That means this patient is not leaving the room. If you're not leaving the room, why would I tell them to wear N95? They don't need anything when they are in their room. It's you, the nurse, who will wear it because this is gone. Proper usage of call bell room, proper usage of call bell and location. Yes, so that they cannot do what? Get out of the room. Location of bedside commode, fine. But this is more important. They will get out. If they don't know where the call bell is located, they will come out and find you. And hygiene with soap and water, it's fine, but that is not important than them leaving the room because they have what? Contact precaution and airborne. Therefore, I'm worried about this one. This is prioritization 101. Client is prescribed cefazolin preoperatively. Client state, I had a rash after taking amoxicillin last year. What is the next priority action? What would you do? Administer diphenhydramine as prescribed to help with the rash. Proceed with giving the medication to the patient. Notify the surgeon of the patient's allergy. Document the patient allergy in the medical record. What would you do? Document the patient allergy in the medical record. The patient said he had rash when he take amoxicillin and he prescribed or cefazolin. These cross-react. Therefore, giving them diphenhydramine, you're ignoring the danger here. Giving them cefazolin is also ignoring the danger. You can see 1 and 2 are saying the same thing. Notify the client, notify the surgeon of the client's allergy is most important. Documenting the allergy is not. Therefore, we're going to pick this one. Now, we can see we have switched gears. What did you notice? It was more fundamentals of nursing question. Now we are on fundamentals of nursing. Key concept. These are the bases of your surgery. Key fundamentals. And then she's teaching the client how to use what? Incentive spirometer after surgery, which action indicate proper technique. How do you teach the patient how to use incentive spirometer? This is a topic, and NCLEX love it because it's a fundamental thing. Everybody make a mistake. Client exhale forcefully into the device, blow into the device. Client inhale deeply through the mouthpiece, taking breath. The client blow steadily until the pistol rises, right? The client perform the exercise 1 hour The client perform the exercise once per hour. Is that what you do? Think about that question. Is that what you do if you're teaching the patient that do this once every hour and then blow until the piston rises? This is the what it look like, and there's a mouthpiece here, and there's a piston here that go up and down. Do you let them take breath deeply through the mouthpiece, or you let them blow? You have to know the purpose of incentive spirometer. We want to expand your lung. How do I expand your lung? I don't expand your lung by blowing things out. I expand your lung by taking deep breath. And therefore, what do you think? This patient has to be taught to take a deep breath through the mouthpiece. This is the easy way to understand it. How are you doing so far? We are number 22. These are fundamental stuff I want you to pay attention to. Which of the following is the most critical nursing intervention based on information? That means all the answer choices are right, but you got to pick one. A female client is scheduled for what? Laparoscopic cholecystectomy. Ignore it. It's just surgery. During the pre-operative assessment, the client reported that she stopped taking oral contraception pills. She stopped taking it when? 1 week ago. Those are your keywords. Patient is going to have surgery and they're taking birth control. They stop it 1 week ago. This is the concept. I want you to write it down, not all everything. If you have a patient who's taking birth control and he stopped taking 1 week ago, what is their major problem? And they're going to have surgery. Instruct the client to resume taking oral contraception after surgery. That's what you want to do. Assess the client for signs and symptoms of pregnancy, right? Whether she's pregnant because she stopped taking it. That will be good for surgery, right? Because then you can stop surgery or make some recommendation for it. Document the client's medication history in the medical record, right? You just document it that they stop it. Inform the surgeon about the client recent discontinuation of oral contraception. What do you think? The concept here is, which answer choice will you pick? And I'll give it to you. Stop the video. The right answer is what? What do you think? It's number 4. Why? Because oral contraception, abrupt discontinuation of the medication will cause more DVT. Therefore, the nurse is going to let the doctor know surgery is going to cause DVT. They stop their medication a week, more DVT. We have a problem. And therefore, that's what we do. Why not resume taking the medication after surgery? You're going to get more DVT. Assessing for signs of pregnancy is important, but not that dangerous compared to DVT. Documenting the medical record, you just ignore it. Therefore, we're not going to do that. Number 23. Number 23. What do you think? What should the nurse do? Another action by the nurse. These are fundamentals. So bring your content regarding fundamentals here. A client who is scheduled for surgery asks the nurse to explain the consent form again. The patient needs explanation of the consent form. What should the nurse do? Review the risks and benefit of the surgery with the patient. Is that what you want to do? They need information. Instruct the client to sign the form and discuss it with the surgeon later. Go ahead, sign it. I'll let the doctor know, come and talk to you. Notify the surgeon to provide further explanation. You call the doctor and say, hey, come and give further explanation. Clarify basic details and contact the surgeon for further explanation. Which one would you pick? Fundamentals can be difficult because of the way everything looks correct. But I got you. Adapt and NCLEX got you. Think about it. There's a reason why you're a nurse. You're part of the healthcare providers. You should know certain things about what is going on with this patient. It's going to have a surgery. It's your patient. At least you know what kind of surgery they're going to have. Find out what they need. Then you can call a doctor. Maybe you can explain in a simple term what they want. Maybe they don't need anything about the surgery. So clarify what is the problem. Explain the consent form again. What do you don't understand? Is it where to sign? Those are the things you got to figure out. If it's about specific to the surgery, yes, you can call the doctor. But maybe they need something about post-op everything that was explained. Therefore, this is much better answer choice, acting as a nurse. During a nurse assessment, the client described the pain as what? 5 out of 10. Okay. Poorly localized, that's the buzzword. Shooting, that's the buzzword. Shock-like, that's the buzzword. What kind of pain is that? I'm trying to let you pay attention to buzzword. That's the adapted NCLEX way of answering questions. So poorly localized. I see visceral pain is poorly localized. I see neuropathic pain is poorly localized. Somatic is more localized. I eliminated a muscle pain. Then I see shooting, visceral pain doesn't shoot. Shock-like, visceral pain doesn't have shock. And you know, the right answer is popping out like a candy. This is the way I say, if you break down the question, the answer choice will pop out like a candy. Now, this is the same thing. We're going to use the same strategy to break things down. Which of the following tests is the nurse performing? The nurse is performing certain tests. Ask yourself, and so what? What are you mean tests? Okay. The nurse is performing eye exams. Okay, looking into the patient's eye. The nurse asks the client to what? Gaze to a distance, look far away, and then quickly come back to a pen in front of you. So this is the patient, and this is the pen. The nurse said, look here and come back here and look at the pen. What am I testing? Is it visual acuity? Is it accommodation? Is it pupillary reflex or cranial nerve 7? I want you to put down your answer. This is a neuro fundamental question, and let me know what you think. But you, I know you picked the right answer because you watch adapting tests. And let's break it down. Visual acuity, you've done it multiple times. You go and they show you a card and you read it. That's what? Snelling test. We don't use that one. Right answer. What do you think? Between the 3 left, is he accommodation, pupillary reflex, and what? Cranial nerve 7. You know, cranial nerve 7 is what? Facial nerve. What does it do? Facial movement. One side will be paralyzed if you have problem. That's not what the nurse is testing. And if you're testing for some of the people, what do you look? You shine pen light in front of their eyes. Therefore, this is an accommodation. You look back, you look, and then you try to accommodate that information. Fundamentals on NG2 and medication administration. What is the next step in administering the medication? A nurse is preparing to administer a medication via an NG tube. After checking for proper placement, you check for proper placement. You confirm it either with X-ray or pH test. Will you flush the NG tube with 30 ml of air? Will you mix all the medication together in 30 ml of water? Will you flush the NG tube with 30 ml of water? Will you administer the medication with the NG tube clamp? Come on, nurses. I know you got this. This is fundamentals. Here's this one. Everybody get it right. It's safety of medication administration. Flushing the NG tube with air is not going to do anything. It will remove the clot, but you got to clean everything with liquid. Mix all the medication together in 30 ml of solution. It's not appropriate. You got to do something first, right? You got to do something first. Flush what? The NG tube with 30 ml is what? What are you going to do with that? That is much better than putting air in it. Administering the medication with the NG tube clamp. You got to do it. They say, what is the next step? C is the right answer. The rest of them are inappropriate. What is the next best action? Same thing. A client is admitted to the hospital and NG tube is injected for what? Feeding. You can use NG tube for decompression and feeding. We're using this for feeding. Before starting the first feeding, the nurse attempts to confirm the NG tube placement using pH testing because that's the easiest way to what? Test it. But is unable to obtain gastric aspirate. pH testing is impossible. What is your next step? Reposition the client, attempt to aspirate again. Proceed with the feeding as the tube is secured externally. Listen over the stomach while injecting air into the NG tube. Request an abdominal X-ray to confirm placement. And nurses, number 4 is the right answer. Because how do you confirm? You still have to confirm before you give the first medication administration, which is now food. Reattempting, the question say it's not working. There's a reason why we ask you to do it. So reattempting is not going to help you. Just because it's externally secured, be just false promising that is secured, we good. We are not good. And listening over the stomach is no more used. The first thing to do is aspirate, which is the easy. You don't need an orders. But if it doesn't work, X-ray. If they said the best and most standard is X-ray. So when you see questions on NG tube about placement, that is the key. A nurse is providing teaching to a client with what? Moderate insomnia. The key word is moderate insomnia. Moderate insomnia, right? Which of the following the nurse should include in the teaching? Select or apply. Before you look at the answer choices, insomnia. What is insomnia? I have sleeping issue. And what would I do? What should I include in the teaching? Should I avoid caffeine before bedtime? Should I keep the room temperature cool and noise-free? Should I avoid reading in bed? Should I engage in moderate exercise 1 to 2 hours before bed? Should I take nap during the day? Should I go to bed and wake up every day at the same time? What do you think? Insomnia is key. Sleep, pain, and comfort is best care and comfort. It comes all the time on the NCLEX. I want you to know this. These are concepts associated with sleeping issue. What do you think? Let me know your answer in the comment. But which of the following should the nurse include? Caffeine will keep you awake. Bad problem. When the room temperature is cool, it's much better to sleep. You shouldn't be reading in bed. You go to bed when you're ready. Moderate exercise is okay, but not within 2 hours. It should be more than 2 hours. So 3, 4, at least 3, 4 hours. But 1 to 2 hours, you're not going to sleep. You should not be taking a nap during the day. Otherwise, you're not going to sleep. And go to bed and wake up the same thing. That means retune is the best way to avoid what? Over sleep and having sleeping issues. So we have A and B, and we have a C, and then we will go for F. So E, D and E are wrong. So those are the ones we're going to pick as our right answer. How are you doing so far? These are concepts on fundamentals. We're going through them, and these are some of the explanation or the things that you need to know when it comes to insomnia and the key aspect of it. So write them down. Now, a charge nurse is orienting a novice nurse to the ward on HIPAA. This is ethics principle. If you need help, I have a bunch of video on ethics that you can watch. If you also want to get access to this Cuban question, I put it on my site on YouTube, and how to get to do 85 questions. It's free of charge. You can just log in with the email. You get 85 questions to test your knowledge, but it's a computer adaptive test, and you can take it one time, okay? A charge nurse is orienting a novice nurse to the ward on HIPAA violation, which situation the charge nurse will classify as a HIPAA violation. HIPAA violation, that means you're sharing patient information you're not supposed to share, right? A nurse assess a client charge, a nurse assess a client chart or information that is not, a nurse assessed a client chart or information that is not needed directly for a plan of care. What do you think? The plan of care, you don't need the information to care for the patient. This is HIPAA violation. A nurse assess a client's relative who is a nurse from another ward. A nurse allow client's relative who is a nurse from another ward to review the client chart. What do you think? You're violating the client patient. A nurse tells a client that the hospital roommate is having MRI. You're not supposed to share that information. A nurse provided a plan of care to a new case manager assigned to the client. The new case manager is assigned to the client. She's purview for the plan of care for that patient. So that is fine. Right. So that's no, so that is fine. A nurse returned a phone call from the healthcare provider about the client while a nurse returned a phone call from the healthcare provider about a client. A nurse returned a phone call from the healthcare provider about the client while in the cafeteria mail line. That is the violation. You should provide some privacy. So these are all abnormal information the nurse is doing and the HIPAA violation. We are 1/3 away. Number 30. A nurse provide care for a client diagnosed with what? Serotonin syndrome. You can see we're switching gear. We're going to what? Mental health. Are you having issues with mental health? Let's try these 10 questions and see how you're doing. But I know you're going to get it. Patient have what? Serotonin syndrome. Which of the following finding is consistent with what? Diagnosis. I want you to select only two. Select only two answers, not all of them. That means there's only two answers. I'm just telling you, there's only two answers. Clonus, erythrosia, diaphoresis, bradycardia, and temperature 104. What do you think? Let me show you the key. The key word is what? Serotonin syndrome. Serotonin syndrome happens when you combine two serotonin. You're taking an SSRI or you take some medication that has serotonin in it. Then you ask yourself, what should I expect? Everything goes up. No matter what you have, it's going to go up. Symptoms are going to go up. How do I pick the answer choice? Pick an answer choice that is going up. Clonus means things are going up. Reflexia means things are going down. You see how I'm approaching this question? That's the way I want you to approach it. Diaphoresis, hey, you sweating, things are going up. Bradycardia, things are going down. Temperature 104, things are going up. But I'm going to take it, but I'm going to tell you, in serotonin syndrome, your temperature will never go to 104. It can go up to 102, but 104 is too much. 104, you get into NMS range, neuroleptic malignant syndrome. Therefore, 104 is not consistent with the serotonin syndrome, but your temperature goes up. So I just want you to I put it there so that I can teach you specifically about that if you see it on the NCLEX. Now, this is a case study, a very short one, and let's review the clinical data to develop a plan of care. Which condition the nurse should suspect the client is most likely experiencing? 2 actions to take and 2 parameters. This is a bow tie question. And then you click on it and you read it. The client arrived in the PACU after 3 hours of what? Hysterectomy, patient had surgery. And how to answer questions on case study, look at the first 2 lines. You figure it out. Patient had surgery. Client is alert, oriented to time, place, and person and situation. I'm fine. My temperature was okay. Heart rate was fine, right? My heart rate was also fine. My blood pressure is fine. Respiratory rate is okay. Saturation is 98.3 liters because he had surgery. Okay, what is going on? The lung is clear. S1, S2 present. Everything is normal. Why are you giving me normal numbers? That's what the NCLEX. It's a normal situation. They're trying to show you how things happen in real life. That's me too. I'm trying to show you. I'm getting NS at 75. I'm okay. 30 minutes later, I'm visibly short of breath with labored breathing. My jaw is locked. My end-tidal CO2 is high. I have very stiff and warm to touch. My temperature is 103. My heart rate is high. Everything is going up. I have irregular. That means I'm getting sick. You can see these are all signs and symptoms of things going up. If this is the problem, things are going up. What is the problem? I just had surgery. What do you think is the problem? That's all. Now, look at it. What condition is this patient suffering from? Is it thyroid storm? Is it serotonin syndrome, neuroleptic malignant syndrome, or malignant hyperthermia? Then after you find the diagnosis, then you can treat it. Then when you treat it, you know what to monitor for. This is how you answer both type question. Therefore, let's break them down. Thyroid storm. The patient had surgery. They never touched the thyroid. They said he had hysterectomy. Therefore, you know this is not thyroid storm, so it's gone. Serotonin syndrome. You get it when you have what? You take medication associated with serotonin. Patient never take any medication associated with that. This is the way you answer questions, right? Straightforward. Neuroleptic malignant syndrome. It happened when you take antipsychotic. Patient was not taking antipsychotic, just had surgery. This is malignant hyperthermia. Now, what action would you take? The action would you take is to cool the patient down. Cyproheptadine is used for SSRI, so it's not good. Dantrolene is yes. That's what you use for malignant hyperthermia. That's one of the medication you will use for that. Does the patient need immediate cardioversion? No. What they need is aggressive cooling. And therefore, we're going to give them dantrolene and you're going to provide aggressive cooling. Now, after you do that, what are you going to do? The temperature is very high. They're going to get sick. What are we going to be doing? We're going to be monitoring the temperature, right? And then what? We're going to check their mental status. These are the things that we have to pay attention to because that's the most important in this situation. Very, very important. But all the other options are reasonable. But the key is to monitor their temperature and check their mental status because they're going to get sick and sick and sick from it. So this is the way you answer these kind of both type questions. And when you see it, I want you to be careful so that you don't get trapped. Number 32, a client statement. You are of the FBI plotting to kill me. I know it. That's what they said. The nurse interpreted this as what? Is this delusion of reference? Is it delusion of somatic? Is it delusion of persecutory? Is it delusion of grandiosity? You are a part of the FBI. You're trying to kill me. That's a fixed belief. That's a delusion. But there's different kind. What is the patient trying to do? Is he referring to somebody, right? Reference. Somebody is talking to them. That is the delusion of reference. I don't think so. Somatic. Is it the body talking to them that my body is weak? I have cancer in my body. That's delusion of somatic. Delusion of persecutory. That means they think you're going to do something to them, right? Or delusion of grandiosity, trying to raise themselves up. I don't see the patient raising themselves up. I don't see the patient saying their body is affected. I don't see the patient is receiving messages through a TV. Therefore, this delusion of persecutory. So that's the way you answer that question. That's the explanation for that particular question. Now, and this is collecting data on the client in the mental health. So these are all mental health issue, mental health concept. There's a reason why this can be difficult, but I want you to get it. Stay with me. I'm going to get you through this. This is the key. It's a case study. Which condition the nurse know the client is most likely experiencing? Go for the buzzword. And I'm going to underline the buzzword as we go through each of one of them. The client report what? Intense. What is the problem? Vivid flashback. Oh, associated with anxiety and hyperarousal. Oh, this is what they're saying. The client has witnessed what? Experienced traumatic. That's the key word. But cannot recall certain details about this event and has become anxious both when questioned about it. So hypervigilance, right? He cannot remember the encounter, right? You report difficulty falling asleep is affecting their sleep. He's hypervigilant, emotionally outbursts. He has difficulty concentrating, nightmares, interfering with the life. I know the way I read it, I know you got it. What do you think is wrong with this patient? Is it generalized anxiety? It looked like that, but that's not it because of the reliving. Acute stress disorder, yes, something happened acutely, but there's more than acute stress disorder. Post-traumatic stress disorder, what do you think? Obsessive. He's not obsessed about anything. He's worried about, he's most likely suffering from post-traumatic stress disorder. So those are the key. He has all mark of that. Flashback, anxiety, hyperarousal, hypervigilance, and difficulty sleeping. Those are the buzzwords. I want you to write it down. And those are key. Now, and it's provide care for 4 clients. Now, and it's provide care for several clients. When caring for which client, the nurse should initiate established trust. That means who I need to establish trust in that patient. What do you think? First, who are you going to establish trust for? Somebody with aggressive and violent behavior, do you need to do that? Persecutory delusion, do you need to do that? Somebody with schizoid, do you need to do that? Paranoid, and schizotypal. Which of these patients, step back and think about it. If I have to take care of this patient, who do I need to establish trust? Put down your answer in the comment and let me know. But any patient who is aggressive, you got to establish trust so that you tell them we're on the same page. I'm going to be cool and you're going to be cool. You're not going to hurt me. Somebody who has persecutory delusion means what? You got to be careful. Everything you do, you think they're going to kill them. Therefore, and schizoid is a portion of schizophrenia. They have some form of delusion. Same thing as schizotypal. Those are all classics. So you have to be what? Close to them and be able to establish trust. And if I'm paranoid about everything, you got to establish trust. All of us, we are in trouble. And then supervisor yell at the nurse. This is our mental health concept, saying you are incompetent and don't know what you are doing. That's the nurse supervisor talking to a patient. The nurse did not respond, did not say anything. 5 minutes later, the nurse yelled at the client saying, you are annoying, just to take your medication. You are annoying, just take your medication. What defense mechanism is that? Break it down. The charge nurse yelled at the nurse. I don't care what they say. It doesn't matter. Just summarize it and say, yell at the nurse. When the nurse went to the patient, instead of confronting the charge nurse, now the nurse is mad at the patient. That's no projection. When you're projecting, it's what you think you are, you think somebody is. Displacement, you're taking the problem that is bad on you and you put it on somebody else. You don't want to give it to the person who gave it to you. And there's no evidence of denial. She has accepted the fact that whatever was said to her, she did not respond to it. Reaction formation, she's not acting opposite inside her. She knows she's in trouble, but she put it on the patient. This is displacement. And that's the answer. This is a form of displacement. The nurse did not confront the charge nurse, but displays the frustration to the client. This question, I want you to write it down because they're going to confuse you. And NCLEX will give you select or apply and it will put wrong information there. Classic. The nurse is teaching the client with what? Respiratory. And nurse is teaching the client with a nurse. And nurse is teaching the client with refractory major depression, scheduled for what? Electroconvulsion therapy. Which teaching is appropriate? This concept, I want you to stop the video, write it down, answer the question, but no ECT. ECT is done to what? Help with depression. After we've treated you for a long time and nothing is happening, we want to create seizure in your brain, and that may help with your depression. There's teaching you should provide to the patient. Avoid consuming caffeine before the procedure. Electric probe will deliver mild electrical impulses to your scalp. Wash your hair the night before the procedure. Is that okay? Is that teaching? You will require pain medication due to the procedure. You should not eat 6 to 8 hours prior to the procedure. You may not remember the entire procedure. You should stop taking your antidepressant. We will induce seizure lasting 10 to 15 seconds. Guess what? These are concepts they will ask you when they come to ECT. And I want you to know that it's very classic. It's very important. Because we're going to induce seizures in you, you should avoid caffeine. It's going to interfere with that, right? The electric probe will deliver shock. They don't cause pain. There's no pain associated with it, so that's wrong. You should wash your hair. That's fine. You're not going to require any pain medication because it doesn't cause pain. Of course, because we deliver seizures, you should not eat. You will not remember after the seizure is done because you have retrograde amnesia. You should not stop your medication. Keep taking it. and we will induce seizure lasting that. And so this is the things you should know about ECT. It's very important. So A, C, E, F, and H are the right answer. Now, this is, like I said, these are mental health concepts. This is problem with cycles of violence. Know this information. It's a simple question. When you see it on the NCLEX, it will be easy. Match each step with the proper description regarding it. Tension building, what is that? Explosion and an honeymoon. Think about it. When you are having cycle of violence, what do you think? When you have tension, what do you think? Is it verbal, physical abuse? Is it sorrow and feeling of guilt, or anger and abusive, argumentative? The tension has to build. Therefore, we're going to be talking at each other. And then I'm going to blow up. That's when I touch you. And then I'll be sorry. I say, oh, sorry. I won't do that again. And this is the way it looked like. So master this concept. And that's the key. Tension building is the first stage where you're arguing, you're yelling at each other. Then crisis will explode where somebody is touching each other. And then we apologize. Cycle of violence. This is also a key concept about substance abuse. I want you to see the way I'm going to approach it, because substance abuse questions can be very difficult. I'll read the question from the back as usual and show you how I'm going to break it down. With substance abuse withdrawal, the nurse should expect, that means the withdrawal symptoms. And nurse provide care for a client in the emergency room with what? Buzzword, visual hallucination. Which of these medication or drugs causes visual hallucination when you withdraw? You're going to have tachycardia. Things are going up. You're going to have slurred speech and talkativeness. Your pupil size is normal. What are you withdrawing from? What do you think? Is it alcohol? Is it cocaine? Is it opiate? And diazepam? I'll show you. The right answer is alcohol. Because of what? What do you think? Because of hallucination. That is key for that. But I'm going to show you other answers, why the other answers are wrong. Let's break them down, right? Opiate, your pupil is not going to be normal. It's either dilated or constricted, because it's downer. When you take in, intoxicate, it gets constricted. When you withdraw, it gets dilated. This is normal. Cocaine, when you withdraw cocaine, cocaine is what? Upper symptoms. So your symptoms should go down. This patient has tachycardia. It's not consistent with that. Diazepam is a downer. Your symptoms all go up, but hallucination is not specific. It's visual as hallucination, which is specific for alcohol. So that is very important information that you should know. NS is collecting data from a client struggling with what? Refractory major depressive disorder in the outpatient clinic. Patient has depression and nothing is working. We try everything. What information would you get from them? That is very concerning. Which statement by the client is concerning? They have depression. They're saying something. Which one should you worry about? I donated all my clothes to an homeless man yesterday. Guys, what do you think? I went to church to say my last prayer. What do you think? I sold my house at half price to get rid of it. What do you think? It's been painful, but I'm looking forward to tomorrow. Life is not easy, but I'm awful about my disease. When you see these questions on the NCLEX, the best way to answer is what? You are managing the problem. You are doing what? Coping. When it comes to psych issue, that's the word you're looking for. Which of these answer choice means I'm coping? The disease never go away, but you cope with it. I donated all my clothes to homeless man. That means you're giving up. You're ready to go. And that is no coping. I went to church to say my last prayer. That is no coping. I sold my house at half price to get rid of it. Just basically, I want to get everything and go away. That's no coping. It's been painful, but what am I doing? Looking forward for tomorrow. Hopeful, I'm coping. Life is not easy, but I'm hopeful about my disease. Those are the concepts I want you to know about depression. All these three, ABC indicate suicidal ideation. D and E indicate coping mechanism. We are close to 40 and we are 40. How are you doing? What is your score? How are you managing? I want you to take a break if you're tired. And I want you to come back because we are on what? Newborn. We're talking about newborn. I fact that show up on the NCLEX. You have to know newborn is part of the health promotion. Most people who I've heard from that did not do well, they did not do well under this section, health promotion. So let's get down and tackle this business. What is the next priority? This is what prioritization. And there's not the yellow thing to the skin of a 36-hour-old. So less than what? 2 days old, but more than 24 hours. Encourage breastfeeding every 2 to 3 hours. Notify the pediatrician for immediate phototherapy. Assess for bilirubin level. Document the finding as normal. What do you think if you see this NCLEX question? If you're taking the enzymes and you see this, what would you do? The key concept is yellowing thing. This is what? Hyperbilirubemia. This is jaundice. Then the concept you need is it 24 hours or after 24 hours? Before 24 hours is bad. After 24 hours is okay. But why is okay? You don't just ignore it. You got to do something about it. This is more than 24 hours. It's okay, but don't worry, but we got to do something about it. Breastfeeding the baby, you mean you want it to go away. You don't know the level. You want something less than 12, right? If it's very high, it's a problem. Notify the pediatrician for immediate phototherapy. Well, it's 2 days. So it's getting to 2 days. So that's not a major problem. But before you start phototherapy, you got to know how high is the bilirubin. Assess the bilirubin level. You look normal. If it's normal, we don't do anything. So I'm supposed to check it. Document the finding as normal process. Fine. It's a normal process, but you should not ignore it. Number 4 is the most common one people will pick. No. 2 is a trap, right? It's more than 24 hours, but at least you need to know. They may need phototherapy. You need to know the level. So assess for the level. This is much, much better. So join this in the first 24, 48 hours, maybe get bilirubin, but bilirubin level need to be assessed. That's the key. 41. During a newborn assessment, the nurse observed a single crease buzzword across the palm of the infant. Know this information. NCLEX love it. It's a typical newborn abnormality that can lead to other questions. What do you think? This is normal finding? Let a pediatrician know about it. Perform a full neurological assessment. Encourage bonding and skin-to-skin to the patient and parents. What do you think? Which one will you pick? I can tell you what is the right answer. What do you think is the right answer? This need a further workup because that's the right answer. It maybe indicates Down syndrome. One is no, A is wrong because that's not normal finding. The patient may need full neurological assessment, but not you. At the same time, Down syndrome doesn't need full neurological assessment. You should let the doctor know. Skin to skin, you basically ignoring the finding that single crease is okay. Therefore, this may indicate Down syndrome. We need a further workup, and that's the right answer. This may be hard, but it's not. If you pay attention to the buzzword. Number 42, which finding require immediate intervention, prioritization. That means all of them are okay, but one of them is number 1. And nurse is assessing a newborn 1 hour, just got born 1 hour, less than 6 hours. Which one should you worry about? That's all. Temperature 97.5, heart rate 125, respiratory rate of 72, and nasal flaring, bluish discoloration of the hands and feet. Stop the video. I would like to know what you pick for this. Hashtag number 42. Put down in the comment section and let me know. Say, adapt NCLEX. I pick this answer choice. 1 hour old. What do you think? Bluey discoloration of the hands and feet is an expected finding. That's acral cyanosis. That's not bad. But if there is a bluish discoloration on the torso, that's bad. But if it's on the extremities, that's okay. So this is okay. Baby heart rate is elevated. 30 to 60 is fine. 72 is high. Respiratory rate is elevated. And they have nasal flaring. Bad sign. The heart rate, 120 is fine. It can go to 110 to look 160 when they cry, 180, 125 is okay. And this temperature is not that bad. Therefore, what are we going to intervene? That one, nasal flaring. Those are bad signs. Nasal flaring, tachycardia indicates respiratory distress. A new nurse is assessing a client born at 43 weeks of gestation. Which of the following the nurse know the client is at risk of? Select or that apply. Same strategy. Break it down and tell yourself, I'm reading it from the back. Select or apply. I don't have to pick everything. Which of the following the know patient is at risk? That means risk factor. 42 weeks. What is the problem? 43 weeks, you are what? Post-term. Therefore, I'm looking for things about post-term. And what complication post-term lead to? Neonatal hyperglycemia, hyperthermia, big baby, microsomia, meconium aspiration, fetal dysmaturity. What do you think? What do you think? If you grow in your mother womb for 43 weeks, you're going to chew all your glucose. Your glucose, all of them, will be gone. You're not going to have hyper. You're going to have hypoglycemia. You're going to get cold. Your temperature is not going to be like that. You're going to get bigger. This is fine. You may poop and aspirate on yourself, meconium, and you're going to have this maturity. Therefore, CDE is the right answer. But this is concept I want you to mention. Master, when you see post-term baby, these are classic post-term baby features. And this is what you see. After 42 weeks, after 40 weeks, getting to 42 weeks, microsomia, hypoglycemia, hypothermia, meconium aspiration, and fetal dysmotility. Normal 44. A nurse is assessing 12-hour-old newborn delivered at 30, what? 8 weeks to opiate-dependent mother. This is a hard one, and I will break it down for you. I got you. Which assessment finding the nurse expect? Irritability, high-pitched cry, very sleepy, hungry, and suckling vigorously. This 42 is the breaking point of our test. We are going 85, but this is our breaking point. There is a concept here. Look at the question. Let's break it down easily. Expected finding. What should I see? Baby was born 12 hours ago. The mother is 30 weeks when the baby was born, and mommy is opiate dependent. Write this down. If the mother is whatever they dependent on, when the baby is born, within 24 hours, the baby is going to do as if they're taking that medication. After 24 hours, they're going to withdraw from it. So within 24 hours, if you're taking what? Opiate? If you're taking opiate, the baby will look like they are taking opiate. That is the key. That is the key I want you to pay attention to. After 24 hours, they're going to be in withdrawal. So the kid is within 24 hours. Therefore, opiate is a downer. That means the symptoms should go down. Irritability is withdrawal. High pitch is withdrawal. Sleepy is intoxication. Suckling is withdrawal. And therefore, 3 is the right answer. You can see how this can be difficult, but this is the strategy. That's why I say the key is timing. Newborn will show intoxication symptoms within 24 hours of birth and withdrawal symptoms after 24 hours if their mother used any drug during pregnancy. And that's the concept I want you to master. The nurse is aware of several 3-hour newborn in a nursery. 3-hour-old. Which client in the nurse see first or should see first? This prioritization. So expected finding and unexpected finding. Baby was born at what? 40 weeks. What should I expect? Or they have testicles in their scrotum. Is okay. 38 weeks, he weigh 6 pounds, in the head circumference is 33. It's 42 weeks, and there is the skin, desquamization of the feet, and absent venom. He has 37 weeks, 22 inches, and waxing substances about it. What do you think? This question is a little bit hard. That's why I put here 45. But there's a problem. 40 weeks old, you're close to postterm, your testicles may be going down into your scrotum. This is fine. 38 weeks, weight 6 pounds is standard weight. This is okay. 42 weeks, baby is old, is the postterm. They have major problem. The cause is hypoglycemia. We saw the symptoms in the previous question. They have what? Microsomia. They may have meconium aspiration. The temperature may go down. Their glucose may go down. That is why you got to pick this. That is the concept. That's why I asked both questions for back to back. I picked those questions to teach you. D is right. This patient is problem. Is too old. And that's the signs and symptoms of that patient. And C, delivered at 42 weeks, desquamization of the feet and absent venom indicate postterm. They're more likely to have issues. That's the explanation for that. A newborn is born at term via what? Vaginal delivery. There's a reason why I say vaginal delivery. Baby born at vaginal delivery, there's a problem, things you have to know. Which action should the nurse take immediately after birth? The question is after birth. What should you prioritize after birth? That is the concept, after birth. Perform full physical assessment. Give the patient vitamin K so that they don't have infection in their eye. Dry the newborn. Place them on the mother's chest, right? Skin to skin. Weigh the newborn to assess their birth. What is the most important when the baby is delivered? Pick one for me. I know you got it because you watch Adapting Class. But what would you do? Physical exams is okay. The question is a prioritization question. Don't pick number one. Vitamin K injection usually is not done right away. You have within 24 hours. We have time. The word said immediately. That's the buzzword. Hypothermia is key. Therefore, this is our answer. That's the thing. Skin to skin to warm the baby up is much more important than doing a full neurological examination. Stop the video, answer the question like I said, and then try to go over the rest of the answer choice. This is also key. It's based on buzzword. What is the next priority? Underlying prioritization. That is the key. That's my key, prioritization. A newborn assessment. During the newborn assessment, the nurse notes the following. Intermittent cyanosis of the lips, not the skin of the hand, but lips. That is central. They have heart murmur. And their capillary refill is what? 4 seconds. That is a problem. What do you think? Place the newborn in a warmer and warm them up so that their skin will change in color. Notify the pediatrician and prepare for echocardiogram that you let the doctor know we got to do something about this. Apply oxygen to the client so that they get more oxygen and reassess them. Educate the parent about normal finding in baby circulation, newborn. What do you think? What is your answer? Number 47. Put down your answer in the comment. Let me know how you're doing. But this is Adapting Class. If you get here so far, you're doing good. I'm with you. We're going through this 85 question. We're learning something. These are concepts I want you to write down. I want you to write them down so that you can go over it. So that when you see a question like this, you got it. Intermittent cyanosis, mama, and a refill, capillary refill of 4 seconds. This is congenital heart defect. You don't have to know the details, whether it is tetralogy or Foley. It does not matter, but that's the classic. Patient need more therapy more treatment, more workup. Therefore, the right answer is going to be we letting the doctor know so that we can do further workup. Why the other answers are wrong is because you are assuming everything is fine. This is not, the cyanosis is central. It's not on the hands and feet. Therefore, warming them up is not going to help. The blood is coming from central. We got to do more work. Assessing for oxygen is not because they have oxygen. They have a heart problem. This is not normal finding. And these are signs and symptoms. Intermittent cyanosis, prolonged capillary refill, and harsh murmur is consistent with the pathology of Foley. What should the nurse do next? Another concept I want you to write down. Red reflex is key. NCLEX love. Asking them recently, people taking the test, have told me that red reflex keep on showing up, and strabismus. This is one of them. Red reflex. The nurse observed no reflex, red reflex in the left eye. What should you do? Repeat the test in 24 hours, notify the pediatrician, document the finding is normal at 48 hours, and explain to the parent that the test will be repeated during discharge. What do you think? This is the key. This is the key, right? Red reflex is not normal. So I'm telling you, if you don't have it, it's not normal. You're supposed to have it. A good red reflex means it's good. If you don't have it, means you may have cancer in your eye, retinoblastoma. So we don't need to repeat the test. It's a warning sign. We should let the doctor know so that we can do further work. This is not normal in the first 48 hours. After 48 hours, it's a problem. It's not normal in the first 48 hours. Therefore, this is never even normal. We're supposed to find something and work on it, because when it's not there, something is wrong. This is retinoblastoma. That is the key for that particular question. That is the key. So I know you get that one. We are 49, almost closed. Stay with me. And then assessing a newborn's moral reflex, which finding is concerning. You know what moral reflex is, right? Staral movement. A newborn cries loudly during the reflex. Do you expect the newborn to do that? A newborn exhibits asymmetrical movement of the hand. One hand moves, the other one do not. The newborn hand extend and return back. All of them go up and they came back. The reflex is absent after the newborn falls asleep. Think about it. Which answer choice would pick? I try not to make it so complicated. I try not to make it so complicated because I want to give you the concept, but test-taking strategy. Baby is asleep. There's no reflex. It's not going to be there. Cry loudly. When you're doing it, it's the staral movement. Therefore, it's okay. Now, 3 and 2 are saying the same thing, but in the opposite direction. One said both hands come together. The other one is asymmetrical. So they both cannot be right. Both cannot be right. And if I'm you, looking at the answer and using elimination, test-taking strategy, if both hands come back, we're good. If one doesn't come back, therefore, this is our right answer. You see, this may indicate a fracture or brachial plexus injury. This is how you answer questions when you don't know what it is. You can see there's a change. What did you see now? Medication, pharmacology. I did a bunch of series on pharmacology. If you need help, this is Adapt NCLEX helping you pass. Watch those videos and practice question on pharmacology. All the major medication, they were subscriber requests, all the subscribers who help grow the channel. So watch them. But this is our 85 question NCLEX practice question with things that you need to know to pass for your NCLEX. What is this? Which should the next question? Patient on medication. Which one is an error? I see warfarin 5 milligram PO. Is it taken by mouth? And then your INR is 2.4. That's how you answer it. It's okay to take it. Your INR is this. You take lensinipro 10 milligram. Your blood pressure is that. You have dilaudid 4 milligram push every 4 hours, PRN for pain. Metropolo 50 milligram and that. Metropolo 50 milligram PO, heart rate of 58 is a borderline normal. But if I'm giving you 4 milligram IV push, I should question this order, right? I should question this order as much as possible because that's a major problem in this situation. A nurse is preparing to administer digoxin to an adult client. Okay. Which of the following actions are appropriate? Appropriate action. Hold if apical pulse is below 60. Give with antacid to reduce GI upset. Assess potassium level before administering the medication. Notify the provider if clients report seeing halos. Administer even if the heart rate is irregular. Digoxin is NCLEX favorite because a bunch of patients are on medication. And the way I remember it, I just draw the individual like that. And I say, oh, they have neurological problem, they have eyes problem, they have GI problem, they have cardiac problem, and they have kidney problem. If you're adult, if your heart rate is less than 60, I'm holding it. Hold it if epical is below 60, that's good. And the acid is going to reduce GI, cause GI reduction of the medication. Therefore, you should not take it with antacid. That's a bad choice. The nurse should not do that. That's really bad teaching. So it's inappropriate. That's what you're going to do, right? That's not. Assess the potassium level before giving. A low potassium will worsen the digoxin. So this is good, appropriate teaching or appropriate action. Notify the provider if you report halos. Halo is a vision. That's a high problem. That means toxicity. We're going to give it to you if your heart rate even is irregular. It does not control your rate. It doesn't convert it into sinus. It's designed to slow down your heart rate. People with AFib taking this medication, you keep them in a lower heart rate, but not all of them can be converted into sinus. So that's the concept associated with this question. Therefore, hold it. Don't take it with antacid. If potassium is low, stop it. Let me know if the patient have halos, and then give it to them even if they have this problem. That is the key. And those are the concepts I want you to pay attention to. Very key. 52. Which action by the nurse demonstrate the 6 rights of medication administration? You know them. There's more than 6, but it's generalized 6 that we apply in medication administration. Asking the client's roommate to confirm the identity. Well, why would you do that? Giving medication from memory without checking the MAR. You got to check it. Medication administration record. Verify the client's name and date of birth with the MAR before giving them. That's a good thing to do. Administering the medication 2 hours after the schedule. That's bad. You're wasting time. Number 3 is the right answer. But this is little things I want you to pay. Like I said, it's a concept for you to know that these are the things they will throw at you. The answer choice may look like, oh, it's easy, but there's a concept there. Pick the concept and stick with it so that you see answer choice like that, you'll be able to answer it. Username, date of birth is acceptable. NCLEX set questions based on concept. The questions are not from heaven or hell. They are from individual test takers. They know what you need to know for a certain topic, and they set questions around it. That is what these questions are for. I'm not saying you're going to see them in the NCLEX. I'm saying that these are concepts they keep on testing. And so know medication administration, know the basics, and that's all. Something like that. You question the medication because of what? They are medical problem and contraindication. That is the concept I want you to write down. I want you to learn from this video. That means if you see a question like that, it's a selected reply. I give you a condition and medication. Is there any contraindication to take that medication? Practicing, should they take metoclopramide? Peptic ulcer, should we take sucralfate? Hypertension, should we take NSAID? Diabetes, should we take glipizide? Bipolar, should we take fluoxetine alone? That is all. What do you think? Stop the video, put down your answer, and let me know. But what do you think? What do you think? Practicing patient, they need dopamine. Metoclopramide, block dopamine. Bad problem. You'll be going to pick that one. Peptic ulcer patient will take sucralfate to help with the acid to heal. It will take sucralfate to help with what? The ulcer to heal. Hypertension, you should not take NSAID because you have water retention, it worsen your blood pressure. Diabetes, you take glipizide for your diabetes. Bipolar patients should not take only SSRI. They need mood stabilizer. They need lithium or anti-epileptic. This is going to worsen them. So these are little things. You can see how I approach the question, and I want you to master them. That's the way you should answer the question. And so this is just a short explanation about why each of them is a wrong answer. Same thing, a client is taking spironolactone. It's a potassium sparing, which prescribed new medication that the nurse knows is appropriate. That means it's okay to take it. It's fundamental concept of pharmacology. Break the question down. Potassium sparing, that means it increases your potassium. I'm going to pick an answer choice that can decrease your potassium. If you pick anything that increases your potassium, it's wrong. Lisinopril, does it increase your potassium? Furosemide, does it increase your potassium? Potassium chloride, does it increase your potassium? Ibuprofen, does it increase your potassium? That's all. What do you think? Give me your answer. Put that in the answer choice. But this is a concept I want you to master, right? Lisinopril increases your potassium, negative. Furosemide decreases your potassium. It's going to help with this. That's good. Potassium chloride is going to increase your potassium. Ibuprofen indirectly affects your kidney, and your kidney increases your potassium. Therefore, furosemide is the right answer. You see how every concept connected? You see how you can get everything connected the way it's supposed to? Thank you for watching. Thank you for staying with me so far. I know this NCLEX, I know NCLEX is a little bit daunting, but it's doable. With one question at a time, we can get there. And this is what we're doing. Same strategy. Read the question from the back. Which new medication the nurse should question? That means combination is bad. Select or apply. Don't pick everything. If you take the NCLEX, pick those that you are 101 confident about. The client is taking what? Sertraline. Identify what is sertraline. And therefore, can it take selegiline, tramadol, St. John's wort, metformin, sumatriptan? That's all. That's what I'm asking you. Go back with your concept. Figure out what you know and bring it to the question to answer the question. I believe in you because you watch Adapt NCLEX. And I'm telling you, select or apply. Don't pick everything. Which medication you should question? SSRI. Which of these has serotonin in it? That's all. MOI. MOI, what do you think? Do they have serotonin or no serotonin? They do. Tramadol, it contains serotonin. Bad problem. St. John's wort, it contains serotonin. Bad problem. Metformin does not have serotonin. Good problem. Sumatriptan is a serotonin agonist. All of them, except metformin, is serotonin agonist. I want you to take a picture of this. Next time when you see a question, somebody taking SSRI and they're taking MOI, intervene. Tramadol, intervene. St. John's wort, intervene. Sumatriptan, used for migraine, intervene. And those are easy way of explaining. This is how my Q bank look like in the easy, straightforward, not extensive explanation, but just give you very short information. Those are concepts you take with you to answer the question. The same strategy, which new medication the nurse should question. That means combination is bad. I'm taking levothyroxine. Know this medication because a bunch of people are on it. What do you need to know about it? Because a lot of people are on it, and you have to teach them how to take it. Should you take it with calcium carbonate, metformin, acetaminophen, ibuprofen? The key is empty stomach, full glass of water. You can remain upright for 30 minutes, but you should never take it with antacid. Do you see antacid there? I did not give you antacid. I change it, and NCLEX will do that. Ibuprofen is not antacid. Acetaminophen is not antacid. Metformin is not antacid. Calcium carbonate is antacid. This is key. Which prescribe new medication, the nurse should question. 57, select or apply. Don't pick everything, but we should question in this patient. The client is taking what? Methotrexate. This is what? Immunosuppressant, right? Anti-metabolic Medicaid drug. It's rheumatoid medication. You have to know how it works. I can tell you, I can give you an idea. It helps by blocking folate. That's how they can prevent cells from what? Growing. Therefore, don't let the patient take medication that will worsen their condition or interact with methotrexate. Give them antibiotic, right? Bactrim, that's sulfatamazole trimethoprim. Should they take it? Think about it. This is key, right? Think about that. Folic acid supplement, should they take it? Ibuprofen, should they take it? Prednisone, should they take it? Aspirin, should they take it? What do you think? Bactrim is sulfur drug. It does the same thing as methotrexate. It's going to worsen the condition. I told you methotrexate is going to block folic. So if you give them folic, it helps with the side effect of the medication. So that is good. I should not question. Ibuprofen will also worsen increased toxicity of methotrexate. Same thing as what? Aspirin. But prednisone is okay to take with. Folic acid is okay to take it. And this is a short explanation how this medication causes problem with methotrexate. How are you doing so far? We are getting closer to number 60. This is 58. Pharmacology. Let's get it together. Let's run through these questions. A new nurse, which new medication the nurse should question? The same thing. Combination is inappropriate. A client taking what? Nitroglyceride, PRN for angina is prescribed what? Which medication? Sildenafil, isosorbide mononitrate, ibuprofen, metformin, and amlodipine. I'm using this particular question to teach you something. There's something there I want you to pay attention to. Why am I telling you not to do that? It's a vasodilator. Which medication causes vasodilation? What do you think? Sildenafil will do that. They should avoid anything that causes vasodilation. Isosorbide, they should avoid anything that causes vasodilation. And what? Amlodipine, it all causes vasodilation. So anybody taking calcium channel blocker or nitrate should not take what? Nitroglycerine, because they all do the same thing. These are little things I want you to know. You see the concept to answer the question? That's all. I'm not making it too hard. Concept, if you take nitrate, don't take any more nitrate or anything that causes vasodilation. Now, we switch gears. These are the challenging ones. EKG, number 59. I want you to get it together. Don't worry. If you have EKG issues, this is the clinical application is EKG. We are not just reading EKG, but I'm showing you how you can read the EKG and apply it. That's how the NCLEX will ask you. You can identify the EKG, but you don't know what to do. Therefore, pay attention and write some keywords. A nurse provide care for a client with this rhythm on the cardiac monitor. What kind of rhythm? What is the nurse first action? What would you do when you identify this rhythm? First, will you provide immediate high quality CPR? Would you perform synchronized cardioversion? Will you assess for temperature? Will you administer metoprolol? What do you think? Now, let's look at the rhythm. First, how do you read the EKG? Look for regularity of the EKG. Is this regular? If it's regular, then that's not AFib or there's no block. And how do you check? You check from distance to distance, here to here. I know this is regular rhythm. Therefore, I know this is not AFib. Then I know if I can see the P wave. I can see the P wave here, but it's very close to the T wave. You see the distance? There's no breathing room, but it's not completely buried, right? It's not AFib because the atrium is there, right? It cannot be A-flutter because it does not look sawtoothed. They are close to each other, right? They're not completely buried. This is what we call sinus tachycardia. If it's almost completely buried, This will be what? SVT. This patient has sinus tachycardia. Therefore, if this is sinus tachycardia, what are you going to do? Sinus tachycardia does not need what? CPR. Sinus tachycardia does not need synchronized cardioversion. Sinus tachycardia may need methylpredol. Sinus tachycardia may need temperature to be checked. But which one would you pick? Clinically, what would you pick? You're going to pick temperature. Why? Because you want to know what is causing the temperature, the tachycardia to go up. There's three things that is common to cause tachycardia in the patient, sinus tachycardia. You can have pain issue, you can have IV fluid, or they're anxious. So figure it out before you give them beta blocker. I know a lot of people who pick normal 4, but before you do that, you got to understand the underlying situation. Is it fluid problem? Is it pain level? Is it anxiety? Is it shock or something before you do something? First EKG question. How did you do it? I know you got it. What are we doing? And next, provide care for a client with what? Pneumonia. During which assessment, the nurse should recognize the rhythm on the cardiac monitor as what? We already seen this, but I'm just using it as a teaching. Pneumonia, infection. I have infection. Well, this is what I have. We saw. This is classic sinus tachycardia. It's the same question, by framing so that you can know this is the way it will be. It does not look like VTAC. We'll see VTAC if there's a question like that. Sinus bradycardia is too fast. Sinus tachycardia is acceptable. It's not SVT because the P and the T wave, I can see a dibble. They are not completely buried. They are not one, but this is okay. So this is sinus tachycardia. Which prescribed medication the nurse should recognize as the cause of the finding? What finding? A nurse perform medication reconciliation for a client with the electrocardiogram finding. This is what we find. What do you think? Electrocardiogram finding. So what do you want to do? This is the finding. And therefore, we're going to read it and figure out what kind of rhythm is that. You can see it's uniform from here to here. This is all uniform. So this is sinus. And I see this is very prolonged. The PR interval is too long. And this is so slow. So you can see this is bradycardia. But what is causing the bradycardia? Is it dopamine? Does it cause bradycardia? Is it bumetanide? Is that bradycardia? Bisoprolol is it bradycardia? And benzodiazepine. Benazepam. Is it benazepam? Is it the one causing the problem? Then you got to identify what kind of medications are those. Then you can answer the question. Dopamine is dopamine for bipolar patient, for Parkinson patient. Therefore, it's not indicated. Bumetanide can cause tachycardia if you lose a lot of fluid. Is what? What do you think bumetanide is? Is what? Is a loop diuretic. The beta blocker would do this. This is ACE inhibitor. It does not affect your heart rate. And therefore, that's your right answer. But this is concept regarding EKGs, and this patient is in symptomatic. It's not symptomatic, but this bradycardia, and this is consistent. PR interval is enlarged. This first degree. And next, provide care for a client with what? This rhythm. Client has no pulse. That's the key. Which action the nurse should take? I have no pulse. Which action should I take? Which action should I take? First, understand it. Am I going to what? Check the client pulse, immediate synchronized cardioversion, immediate high quality CPR, immediate defibrillation. What kind of rhythm is that? This is what we have. Same thing. You can see this rhythm is slow, is what? Sinus, and the heart rate is low. The PR interval is normal. It's not that fast like the one we saw. It's not that long like the one we saw. This is normal. Therefore, this is classic bradycardia compared to the other one, which is first degree. Now, if you know it's bradycardia, but what is the problem? He has no pulse. Therefore, it's not bradycardia. Bradycardia has pulses. This patient has no pulse. What would you do? This is what we call pulseless electrical activity. Once again, write it down. Pulseless electrical activity. That means your heart is giving you signal, but it's not working. If your heart is not working, what is the procedure you do? Think about this as asystole. The heart is dead. What do you do for asystole? You don't do what? You don't check for pulse because the heart is dead. At the same time, I told you the patient has no pulse. Why would you check for pulse again? You don't synchronize cardioversion because there's no rhythm to synchronize cardioversion. This is a fake rhythm. You don't defibrillate because the heart is not pumping. You need to start CPR. So that's what you do for PEA asystole. It's a non-shockable rhythm. So write it down. PEA, non-shockable rhythm. Now, what should the nurse do first? First action. And nurse observe this rhythm strip on the client monitor during initial assessment. What is the rhythm? That's what we have. Think about it. We'll come back to it. Do you do CPR? Do you do defibrillation? Do you immediately feel for pulse in the carotid artery? Do you notify the healthcare provider? We got to read it. What is the key? When you read the EKG, first you see if it's a standard EKG. It's not. You see atrial rhythm? Not. These are all ventricle. Therefore, it's a ventricular problem. Is it uniform? Yes. It's not fibrillating, so it's not VFib, but it's a VTAC. Therefore, if it's a VTAC, what do you know? What do you do? What you should worry about? Because VTAC management is based on two things. Once again, VTAC, if you see a question on VTAC, is based on two things. Do you have a pulse or no pulse? Because if you have a no pulse, you considered VFib. If you have a pulse, then I want to know if you have symptoms. If you have no symptoms, I can give you medication. If you have symptoms, then I cardiovert you. This is the way you manage VTAC. This is the easy way I do it. You see, I've given you all the information so that when you see your question clinically, this is how you can approach it. Therefore, what do you think we should do? Which answer choice? We need to check a pulse to make sure patient is doing okay. How are you doing? I know EKG is troublesome. It may be intimidating to you, but you're going through the clinical aspect. You can watch this portion of the video multiple times until you master how to answer EKG questions on the NCLEX. Clinically, you can use this for ATI or SC exams. And these are key aspects of the things you should know. What is the problem? Order the steps the nurse should take based on the information provided. This is order steps. And nurse provide care for a client with new finding on the monitor. What kind of finding? Look at it. You look at the one that we saw, but this is different. It's fast rhythm, number one. What number two? What do you see? Look for the P and the T wave. There is no, you can see that you only have one space here. This is not sinus tachycardia. This is SVT. That is the difference between the one we saw. This is SVT because supraventricular tachycardia, we have the atrium and the T wave, they all come together. There is no space. Therefore, this is SVT. How do you manage SVT is the question. What are your steps in the management of SVT? First, you got to go through the steps. Do you repeat the EKG? Do you repeat adenosine dose? Do you place IV in the antecubital fossa? Do you monitor the patient? You give them check for chest pain, give them adenosine over 1 to 2 seconds and flush it. First, this patient has to be on a cardiac monitor. So put on a cardiac monitor. Then you need the IV access so that you can give them the IV medication. Then you got to give them adenosine. So administer adenosine over 1 to 2 seconds. Then after that, you got to flush it so that it can go faster and it can stop the heart. Then you should monitor for chest pain. And everything is good, you repeat the next dose. This is the way you give adenosine. I want you to take a picture of it. First, know that you use it for SVT, and these are the steps you take to do medication, safe medication administration regarding SVT. And this is the explanation. The strip is SVT, and these are the things you do for that. Now, cardiac monitor showed the following rhythm. And next care for a client on the message board admitted for pneumonia, infection, reporting sensation of there's fluttering, skipping beat. Why is my heart skipping beat? Is this AFib? Is this A-flutter? Is premature ventricular contraction? Or is VTAC? This is EKG. Look at it. You can see there's uniformity. Then there's somebody pop out all of a sudden. You start from here, uniform, and then these pop out. Then these set up and go back. It looks like AFib, but it can be AFib because you can see atrium here. Therefore, it's gone. It can be VTAC because you don't see uniformity. You can see atrial rhythm here. So this is not just a ventricular rhythm, this is ventricular atrial. The problem is this guy is abnormal. It's not supposed to be there. It's premature. It fire before the rest of them set up. So based on that, you can see it can be AFib because I can see a bunch of atrium. I can see atrium. A-flutter, I don't see sawtooth information. VTAC, I see atrial information. Therefore, this has been premature. You see how I read the EKG. Don't make it so difficult. Just step back, analyze it. You can see that you can master it. How are you doing? So far, EKG, right? 66. You get in there, you mastering it. And there's enter a client's room when the rhythm shown below was observed. As soon as the nurse went in, the rhythm below was observed. The client is reading in bed. I'm reading in bed. I'm not doing anything. What is the nurse first action? What would you do? This is what you see. It's bradycardia, slow heart rate, very slow. What would I do? Do I give the patient atropine? Do I put transcutaneous pacemaker, pacing device? Do I ask the client how the client is doing? Do I give them metoprolol? This question is asking for specific things, is testing for specific things. What is testing for? How do you treat bradycardia? What do you think? Which answer choice will you pick? I want you to put down in the comment section and let me know. And also, I want you to tell me why you picked that answer choice. What do you think? This is Adapt and Place. Thank you for watching so far. And in order to grow the channel, I need you to put a comment in the comment section and let me know how you're doing and let me know how the cases are going, how the questions are going, and what do you think you're going to put down for this answer choice. The key concept here is what? Bradycardia, we treat you with atropine if you have symptoms. If your heart rate is low, maybe that's where you live. So I need to find out whether you have symptoms. That's all. I don't pace you until I've treated you with something or you get in shock, right? The metoprolol is going to lower your heart rate more. Therefore, the right answer is assess for symptoms. Why? If I know that you're having symptoms, then I can treat your bradycardia. If it doesn't help, I may give you, we will put a pacer device on you. If it doesn't help, then we do something else. But if I give you beta blocker, it's going to block you. If I give you atropine, you have no symptoms. These are the things you do first. Go through the motion. And then you can figure it out. Few more EKG questions. 67. After connecting the client to the cardiac monitor, the nurse recognized this rhythm. The nurse assessed the client in the emergency room. What do you think? You connect them and you see this. First of all, see if it's regular. You can see this is a regular. It's not AFib. See if you can see atrium. I can see atrium, but I can see it well because the atrium and the the P wave and the T wave are buried. You see only one, not two. They completely buried. It can be sinus tachycardia because they completely buried. It can be VFib because I see atrial rhythm. It can be VTAG because I see atrial rhythm. It can be bradycardia because it's too fast. Therefore, what you left with, supraventricular tachycardia. This is the way we read EKG. And this is the explanation for that. Same thing, we've seen this rhythm before. A nurse is assessing a client in the emergency room. The nurse observed the rhythm below on the cardiac monitor. Client has no symptoms. I see this rhythm, but I'm not having problem with it. There's a reason why I said no symptoms. It means something. What would you do? Adenosine, diazepam, metoprolol, or atropine? What would you think? This is what? SVT. What is the treatment for SVT? Diazepam, metoprolol, atropine, adenosine. Anything that will slow down your heart rate. Atropine will speed it up. Metoprolol will slow it down. Diazepam will slow it down. Adenosine will slow it down. But what do you use for this? The best answer choice is what? We've seen it multiple times. So let me know what you think. What answer choice did you pick? What answer choice do you pick? This is SVT, and adenosine is the most important medication. All the rest can treat it, diazepam, metoprolol, but the most effective way of treating SVT is to give them adenosine. Write it down. Don't forget that concept. 69. A nurse is teaching the client in the second trimester about expected cardiovascular changes. What did you notice? We have transitioned from what? EKG to what? Maternal health. Like I said, I did a bunch of videos on maternal health. It's a series that we're continuing. I want you to follow. Go into my YouTube channel, find those videos if you're having problem with maternity. But this is one of the questions they may ask you. Expected finding in what? Cardiovascular expected finding in the patient who is pregnant. This is antepartum question. Which statement indicate understanding? My blood pressure will rise steadily throughout. That means your blood pressure keep on going up. My heart rate will increase by 10 to what? 15. That's what they're saying. Their blood volume will decrease. And then their cardiac output will remain the same before as pregnancy. What do you think? There's a concept here, and I want you to get it. This is very key. Antepartum questions you may see. Which answer choice would you pick? Which answer choice? What do you think? Let me know in the comment section. But your heart rate is going to increase, right? Your blood volume is also going to increase. Your cardiac output is going to increase. Therefore, my cardiac output remain the same as before. It's wrong answer. I should expect my blood volume to decrease. Is the wrong answer. My blood pressure is not going to increase steadily. That's preeclampsia. Therefore, this is the right answer. Okay, so this is the key I want you to pay attention. This is how much it goes up, and that's the associated symptoms. And then it's teaching about cervical cancer screening and promotion, right? Which statement by the client indicate correct understanding? What do you know about cervical cancer? Know this. I'll begin pap smear at what age? 21, regardless whether you have sexual intercourse or not. If I had HPV vaccine, I don't need pap smear. Is that okay? Pap smear are done after what? 30 years. Is that right? If I'm not sexually active, I will not need pap smear. What would you choose? This is health promotion. I know you got it. I can tell you the right answer is not D. Why? Because whether you have sex or not, you're going to have pap smear. Your sexual activity increases you having what? Cervical cancer, and we do it more frequent on you. Not frequent, but mostly we screen you, right? And therefore, this is wrong. Pap smear does not start 30. It's too old. And if you have vaccine, you still need pap smear. Therefore, just by elimination, this is your right answer. And this is key. We do it regardless of sexual intercourse. What should the nurse do first? Prioritization. The client is in active labor stage of labor. That's what the patient is. And you're requesting opiate, active stage of labor. Probably they're going to go transition phase and they're requiring pain medication. What would you do? Give it to them for comfort, check the baby heart rate, a mommy contraction, put the mommy client into a deliberate position and offer spinal anesthesia instead. Which one would you pick? I can tell you 2 is the right answer. Why? Active phase, opiate is going to cause respiratory depression. It's going to slow things down. Labor is going to prolong. We should not do that. So don't give it for comfort just because they need it. Placing the client to a deliberate position, it means you still want to give it to them without not doing assessment. Assess before opiate. Spinal anesthesia, they ask for opiate. You don't want to give them standard anesthesia. That's not what they ask for. What instruction is best? That means which one is best? The client is in third trimester, reports shortness of breath when doing what? Laying flat. What would you tell them? This is expected in pregnancy. Try using pillows when resting. You may be developing preeclampsia. These indicate preterm labor. You should restrict fluid at bedtime. Third trimester, mommy stomach is big. The belly, she's too gravid, right? And this is their chest. The diaphragm is being pushed by the uterus. If you lay flat, it's a bad problem. That's why we tell you not to lay flat. Therefore, which answer choice you think is appropriate? This is an expected finding. 2, there's no indication of preeclampsia. It has nothing to do with shortness of breath. You need to have what? Neurological changes. You need to have kidney problem. You need to have your blood pressure to go up. It does not indicate preterm labor. There's no contraction there. Restricting fluid will not help with the shortness of breath. That's all. Which nurse recommendation is most appropriate? 9 weeks reporting nausea. How do you treat it? I pick most antepartum questions because they are friendly, they are gentle, but you got to be comfortable answering them. Nausea, morning sickness, well, eat 3 large meals. Drink fluid with milk to promote digestion. Eat crackers before getting out of bed. Avoid protein in the morning. There's so many remedies for this, but there's one for exams that you're supposed to know. Small frequent meal at the time. Things that will prevent nausea. Which answer choice would you pick? Let me know. Let me know your strategy for reporting or for treating morning nausea clinically. Let me know. You can put it down. Next time I'll take a look at it and put it in the notes. Key concept, how morning sickness help, what kind of treatment you have. What do you think? But I can tell you small frequent meal at the time. So this is the right answer, number 3. Therefore, 1 is wrong because it's a 3 large meal. You want small frequent meal. Drink fluid with milk to promote digestion. There's more likely to cause nausea. You should not avoid protein. What is this testing? Once again, antepartum questions. There is a reason why I picked them because they are key counseling questions. Which should the nurse recommend? A 28 weeks pregnant lady asking about vaccine. Before you answer pick an answer choice, tell yourself, pregnant lady is immunocompromised. I should not give them any live vaccine. Next thing you ask yourself, which one is a live vaccine? That's all. That's how you answer the question. So in my head, I said, what? I have 28 weeks. I need vaccine. And I write it down. I said, I don't need any live vaccine. And I look at the answer choice. I said, which one is a live vaccine? Tdap, is he a live vaccine? MMR, is he a live vaccine? Varicella, is he a live vaccine? Influenza, inactivated, is he a live vaccine? HPV. What do you think? Think about the answer. And let's break it down. We all know MMR is a live vaccine. Varicella is also a live vaccine, in addition to HPV. The oral form, in the activated form, influenza is a live vaccine. This one said inactivated. This is what we got all the time. The nasal one, we get into trouble with. Therefore, this one and that one is acceptable for this particular patient because they need non-live vaccine. 75, 10 more questions. You have done a good job picking up with the pace. Put down in the answer choice in the comment section and tell me you are here. I'm here at 75. I'm here to take the 10 more. And I'm going to learn from it because what are you going to see? We're going to see pediatric question, growth questions. Those are classic NCLEX questions I want you to master and a few NGN. And then administer magnesium sulfate, which finding require immediate intervention. What does magnesium going to do? Respiratory rate 10, reflex is absent, urine output 50, serum magnesium of 7.5, client report flushing and warmth. Temperature. Which answer choice you want to pick? Before you answer choice, pick this. Tell yourself, select that apply. If I know 2, I'm picking 2. If I know 3, I'm picking. I'm not picking all 5 if I don't know it. Then you go back. You say, what is magnesium? It's going to drop everything. If I give you magnesium, I'm increasing your concentration of magnesium. That means things are going to go down. Therefore, how low do you want it to go? Respiratory rate of 10. It has gone too low. If you go below 12, we have a problem. If you don't have reflexes, we have a problem. Your urine output, if it's go down less than 25, this is up. If your magnesium is too high, we have a problem. And you are flushing and warm, that's the expected finding. Therefore, which one are we worried about? What do you think, guys? Which one are we worried about? Respiratory rate of this is too low, reflex is going down, and your serum magnesium is too high. Those are bad stuff. And I want you to take a look at the explanation, and that's what I've explained to you. Too high the level, and the respiratory are going down too much, and you have no reflexes. Now, a few more questions, then we'll be done. And this is caring for a client immediately after amyotomy. Which intervention are indicated? Select and apply. Assess the fetal heart rate, monitor for cord prolapse, place the client supine with the leg flat, observe the color and the odor of the amniotic fluid, and delay vaginal exams until 12 hours later. Stop your video and let me know what you think. Let me know which answer choice is appropriate. But if you do amyotomy, right, fluid leaks, what is going to follow? Placenta is going to follow. You have cord prolapse. Therefore, I'm going to monitor for it. If I have cord prolapse, the baby heart rate is going to change. Mommy is not supposed to be in the supine. That is bad. Need to chest is better. I need to see what fluid come out and whether there is signs of meconium infection. Check. And you need to continue to assess the vagina to make sure there's no cord prolapse. Waiting for 12 hours is not a good idea. And you can see how the answer choice is clear and precise and it popping out like a candy. If you break it down that way, you can answer any questions the NCLEX will give you. All the information is in the question. Bring your content with it. Now, don't run away. This it may be intimidating, but you know it. It's just a picture. What is the most common complaints the caring nurse should anticipate for a client in labor position with that? This is the fetal position. The question is complain. Underline the word complain. Stick with complain. That means what is the mommy going to report about? Then you look at the question and you say, what is the problem? This is the fetal monitor picture that we've seen from the baby situation where it's located. When you see it, your right side is mommy left and your left side is mommy right. This is the baby. The baby is facing what? Face is towards anterior, by the back of the head. That's the occipitus. Is the most important. Is touching the back on the right side of the mother. So we have right occipital posterior. What are the signs and symptoms mommy is going to show? Whenever they contract, are you going to have pressure in the pelvic? You're going to have back pain. You're going to have abdominal pain with contraction, or you have dark vaginal bleeding. There's not going to be dark vaginal bleeding. That's no placenta obstruction. Baby is going to push on the back of the mother. It's going to cause pain. So the right answer is back pain. Pelvic pressure is indistinguishable from that. And abdominal pain is irrelevant. And therefore, that's the right answer. And I've given you the answer for this. This is the same thing. What is the baby position? It's right occipital posterior. If it's here, it will be left occipital posterior. If the baby back is facing the anterior, it will be right anterior, occipital anterior, whether it's on the right side, on the left side. If you need more how to name this, check a Dublin case for content like that. So this is right occipital posterior for this patient. Fetal monitoring. Is it a problem for you? It may be. But if you need more help, check out Dr. NCLEX. We have a bunch of maternity videos on fetal monitoring that can help you. What do you think? What is the first action? What are you going to do? The nurse observe a client in labor, and this is what we find. This is what we find. What are we going to do? Right? Reposition the client to the left side. Administer oxygen. Reposition the client in the knee to chest position. Infuse isotonic solution. Before you answer the thing, look at the diagram again. And I can tell you, fetal monitoring, always really like that. This is the mother, and this is the baby. The contraction here represents mommy. If it's less than 5 or 5, that's good. We have 3, this is good. What is happening to the baby when the mommy contracts? Look at how. Mommy contract. What is happening? When the mommy contract, you draw from here. Nothing is happening. But then when the mommy is at the peak, baby heart rate drop. But here, mommy is not contracting. Baby heart rate drop anyway. Mommy start contract. Baby heart rate drop in the middle. Mommy is not contract. Baby drop. This is what we call variation between contraction and the fetal heart monitoring. There is variable deceleration. Then you write your VHOP. Mine, you said variable deceleration. What does it lead to? It does not lead to what? Placing the client in the left lateral position. That is placenta insufficiency. This is called prolapse symptoms. Giving them oxygen is okay, but the best answer is knee to chest position. So this is the way you think about it. You can give them fluid, you do your lie-on, but patient is in what? Having variable deceleration position first before fluid. So that's what you do. And that's the way I will explain it to you. How are you doing so far? 5 questions, almost there. You're going to ace this. It's Pete's questions. I know you got it. The parent of a 15-year-old child asked the caring nurse when the child will be ready to toilet train. What is toilet training and when is it appropriate? How would you respond? Toilet training occurs when the child has sphincter control by 18 to 24 months. When the child expresses, when I think I have the urge to defecate or urinate, that's when I can train you. When the child can follow simple command, I can train you. When the child can walk to and sit on the toilet, I can train you. When the child can pull clothes up and down, I can train you. I want you to stop your video. I know some of you have kids, and try to answer this question and let me know whether it applies to your answer. Use your clinical knowledge, at the same time use experience, but it's concept associated with the NCLEX, and see if it matches with what I'm going to give you. What do you think? Your answer in the comment. 1, toilet training. This is the age that it can happen. When you have sphincter control, it's best to do that. When you have the urge to defecate, they feel it, that's good. They can express it. Mommy, I feel like I got to empty something. That's good. When they can follow simple commands, say, go and sit in the toilet, yes, they can do that. If they can walk to the toilet, it's okay. And if they can pull themselves up, that's good, right? But you don't have to pick everything. Don't pick everything. If you're confident about all of them, pick it. But if you're not, pick those you're confident and walk away and take your 2 or 3 points and take it away. These are Dr. NCLEX Q-Bank questions that I have for my on-demand. If this is helping you, you can subscribe to that. But this is questions I created for my on-demand to help with my crash course. And this is assessing a fine motor development. That's the key. Fine motor, no gross, fine, precise, in a group of children at the outpatient period, which finding the next you expect as age appropriate in the fine motor milestone. Growth and development questions are tricky. They use so many languages. Don't worry. Let me break it down, make it this easy question as much as possible. That means they say age appropriate. And I should expect for what? Fine motor. You see the buzzword underline, therefore I connect them. Fine motor, expected, appropriate in this age group. A 12-month-old, what can they do? That's what the question is asking you. What can a 12-month-old do to tell you they are fine motor? Is it fine pencil grab? 18-month-old, when they're eating with their fingers? 24-month-old, when they're eating with the spoon? 30-month-old, when they can turn the page? 36-month-old, when they can use a fork and occupy. I pick the standard age the NCLEX is going to ask you. These are the ages that is very common. The NCLEX will ask you, and I pick them. What is your answer? And which one will you pick? Is a select or apply? You don't need to pick everything. I can tell you all of them is showing standard fine motor skills. These are all things I want you to write it down. These are standard. If the NCLEX is going to ask you for each age group, this is the one they will ask you. So write it down. And this is also a key thing about 6-month-old. I want to give you everything. So the answer choices are long. It's extended, selected, apply. And then it's assessing a 6-month-old well-child baby visit, which finding is appropriate. If you have a 6-month-old and you have mastered your growth and development, what do you think a 6-month-old features are? Stranger anxiety, separation anxiety, sitting with the support, double their birth weight, their presence of soft anterior fontanelle. You're going to see posterior fontanelle. They're going to have pencil grabs. They're going to roll from front to back. They're going to have no palmar grabs. They're going to pick a falling object. 6-month-old, a bunch of answers. Is a selected apply. This is to teach you. NCLEX is going to not give you that long selected apply, but I want to give you the content so that you can be comfortable when you see extended selected apply, you don't run away from it and you pick those you're confident. Stranger anxiety is classic for 6-month-old. They don't like any strangers to come up. Separation anxiety is too young. The kid is too young, usually 9 months. That's when they can feel it. 6-month-old should be sitting with support, not ready to be alone. Their birth weight would double, right? Now, 12 months, it will triple. The anterior fontanelle take a long time to close after 12 months. Posterior fontanelle should be closed by 3 months, so you're not going to see it. Pencil grab is too young. At least 9 months is okay. They can roll from front to back. And they can have palmar grabs should be gone. After 3 months, it should be gone. The reflex, you put your hand in your palm and the grabs feel really tight. And then what? They can pick a falling object. That's easy for the kids to do. So these are standard things they can do in 6 months old. 3 more questions. Which toy is appropriate for a toddler? What do you think a toddler should do? They can dress up like with the clothes, pounding a board, using a puzzle, and then what? Rattle and rhyme. When you see this kind of question, don't worry, don't freak out. Ask yourself, what can a toddler do? What can I give them to improve their function? A toddler, what do they need? You want something that will make them physically strong, right? And independent. A dress up is like somebody who's pretend play, right? That's a preschooler, right? Pounding board is what? Who is going to do that? Beating a parcel is too young for the patient to do that. This is mostly a school age. And rattle is an infant. Therefore, they're going to pound their board. So these are things that they can do it on their own. Nobody touching them. Now, NGN question. What do you think? And next assess a client with COPD, next generation question. For each finding, identify if there's an expected or unexpected finding. What do you think? Somebody has COPD. Should you expect clapping on the fingers? Do you expect their saturation to be 80%, 88% on room air? Take secretion, the tachypnea at rest, decrease breath sounds, and chest pain when inhaling deeply. He has COPD. What do you expect? Clapping on fingers is a standard COPD finding, indicate hypoxia, expected finding. Their saturation is not going to be 100, and room air 88, probably that's where they're going to live. If you have thick green secretion, they may have pneumonia. It's unexpected. If you have tachypnea at rest, sometimes that's normal for them. They may have decreased breath sounds. That's normal because that's for COPD. If they take a deep breath and inhale chest pain, this is unexpected. That's a problem. So that's things that you see in a COPD patient. So those are all some of the things I want you to pay attention. And the last question, 85 question, NCLEX practice question. We started with what? Prioritization, delegation. We went to infectious control. Then we went to mental health. We did a pharmacology. We did maternal health. We did peds. Now we finished growth and we're on next generation. Few questions. One last question. Let's get it done. And next assess a newborn 10-month-old after delivery. Identify if each finding is appropriate or require intervention. Which one require intervention? It's a newborn 10 minutes after delivery. Identify if each finding is appropriate or require intervention. The baby hands are blue. Nasal flaring. Baby has Babinski. He has grunting on respiration. His heart rate is 140. He has floppy muscle. What would you think? Put down your answer in the comments. Let me know. 85. So that I know you get to the end of this. 85. Bluish hand discoloration is appropriate. It does not need intervention. Nasal flaring, though, is respiratory problem. Baby just born 10 months, 10 minutes, they may have Babinski. Grunting is a respiratory problem. Their heart rate, 110 to 160, is appropriate. Your muscle is going to be not floppy. That's not good. 85 question. NCLEX practice question. Talking about major topics shows up on the NCLEX that you need to pass. Also used for your NC or ATI exams for nursing school. These are high-yield fact with questions and answers, concept, maternal health, pharmacology, infectious control nursing, peds nursing, fundamentals nursing, prioritization and delegation, NCLEX prioritization and delegation, and EKG strip interpretation and understanding. Thank you for watching. And if this video helped you understand this concept, just put a small comment in the comment section and let us know how you're doing. This is the only way YouTube can show the video to you and other people that care about small token of comment when you watch the video. Thank you very much. And if you want more content, I will link some to this video. You can subscribe to Adapt NCLEX for more content like that. And take care for watching this 85 review on comprehensive management of things that shows up on the NCLEX. Take care of yourself and bye.